If you suffer from chronic pain, you know that it can make you feel almost like a spectator in your own life. Neurostimulation, a proven therapy recommended by physicians for over 40 years, may help you become a full participant again. Thanks to advancements in neurostimulation technology, doctors can now recommend a therapy designed to treat your specific type of pain, greatly increasing the chances of relief. Today, pain relief is possible. Introducing the latest advancements in neurostimulation therapy that could relieve your pain and help you return to your life. Dorsal root ganglion, or DRG stimulation, and BurstDR stimulation. DRG stimulation is an option for people whose pain is concentrated in specific areas, such as the foot, knee, hip, or groin, also referred to as Complex Regional Pain Syndrome, or CRPS. DRG stimulation has the unique ability to directly target the area where the pain occurs. BurstDR stimulation is best for people whose pain is more broadly spread in the trunk and/or limbs. Studies show that BurstDR stimulation may improve the ability to perform everyday activities and possibly even relieving the emotional suffering that pain can cause, as measured by Visual Analog Scale, or VAS. If you suffer from focal pain felt in the foot, knee, hip, or groin, you may be a candidate for DRG stimulation. DRG stimulation is an FDA-approved therapy that was designed to provide targeted pain relief for this type of pain. DRG therapy stimulates the dorsal root ganglion, a cluster of nerve cells in the spinal column, to directly target the area of the body where your pain occurs. In the Accurate IDE clinical study, this therapy was proven to provide pain relief to more than 8 out of 10 patients at 12 months and provide more than 80% pain relief to nearly 7 out of 10 patients at 3 months when compared to traditional neurostimulation therapy. DRG stimulation has shown to provide superior pain relief when compared to traditional neurostimulation therapy for CRPS of the lower limbs. Introducing BurstDR stimulation, another exclusive advancement in neurostimulation therapy that could relieve your pain and help transform your life. BurstDR stimulation is an FDA-approved therapy that was created by doctors to mimic naturally occurring patterns in the brain. This advanced technology is believed to address both physical pain and its effect on you emotionally. In numerous studies around the world, BurstDR stimulation has been clinically proven to improve performance of everyday activities. And one recent clinical study showed the majority of patients preferred BurstDR stimulation and received superior pain relief when compared to traditional neurostimulation therapy. Neurostimulation is a therapy that works to reduce pain by altering pain signals as they travel to the brain. With this therapy, a small generator, similar to a cardiac pacemaker, sends pulses through thin wires called leads to nerves along the spinal column. The pulses modify the pain signals as they travel to different parts of the brain, changing the way your body perceives the pain. One of the benefits of neurostimulation therapy is that you can try the therapy using a temporary system to see if it's right for you. With our temporary systems, you can control your own pain relief through an easy-to-use patient controller. The small external generator easily hides under your clothing so you can go about your day without anyone knowing you have it. Don't settle for being a spectator. Pain relief is possible. With the right therapy designed to treat your specific type of pain, you can get back to being a full participant in your own life. Talk to your doctor today to determine if neurostimulation therapy is right for you. To request additional information about DRG stimulation and BurstDR stimulation, and to watch videos about patients like you, visit poweroveryourpain.com. While neurostimulation helps most patients receive at least some reduction in pain, not everyone responds in the same way. The amount of pain relief varies with each individual. Complications related to placement and/or use of the device may occur, including painful stimulation, loss of pain relief, and certain surgical risks such as paralysis. Be sure to discuss the risks and benefits of neurostimulation with your doctor. RX only. Brief summary. Prior to using these devices, please review the user's manual for a complete listing of indications, contraindications, warnings, precautions, potential adverse events, and directions for use. DRG stimulation indications for use. Spinal column stimulation via epidural and intraspinal lead access to the dorsal root ganglion as an aid in the management of moderate to severe chronic intractable pain of the lower limbs in adult patients with complex regional pain syndrome, CRPS types 1 and 2. Study subjects from the ACCURATE clinical study had failed to achieve adequate pain relief from at least 2 prior pharmacologic treatments from at least 2 different drug classes and continued their pharmacologic therapy during the clinical study. Please note that in 1994, a consensus group of pain medicine experts gathered by the International Association for the Study of Pain, IASP, reviewed diagnostic criteria and agreed to rename reflex sympathetic dystrophy, RSD, and Kazalja as complex regional pain syndrome, CRPS types 1 and 2, respectively. Contraindications. Patients who are unable to operate the system, who are poor surgical risks, or who have failed to receive effective pain relief during trial stimulation. Warnings, precautions. Diathermy therapy, implanted cardiac systems or other active implantable devices, magnetic resonance imaging, MRI, computer tomography, CT, electrosurgery devices, ultrasonic scanning equipment, therapeutic radiation, explosive or flammable gases, theft detectors and metal screening devices, lead movement, operation of machinery and equipment, pediatric use, pregnancy, and case damage. Adverse events, painful stimulation, loss of pain relief, surgical risks, e.g. paralysis. Implant manual must be reviewed for detailed disclosure. Refer to the user's manual for detailed indications, contraindications, warnings, precautions, and potential adverse events. Spinal cord stimulation. Indications for use. Spinal cord stimulation as an aid in the management of chronic intractable pain of the trunk and/or limbs, including unilateral or bilateral pain associated with the following: failed back surgery syndrome and intractable low back and leg pain. Contraindications. Patients who are unable to operate the system or who have failed to receive effective pain relief during trial stimulation. Warnings, precautions. Diathermy therapy, implanted cardiac systems, magnetic resonance imaging, MRI, explosive or flammable gases, theft detectors and metal screening devices, lead movement, operation of machinery and equipment, postural changes, pediatric use, pregnancy, and case damage. Patients who are poor surgical risks with multiple illnesses or with active general infections should not be implanted. Adverse effects. Painful stimulation, loss of pain relief, surgical risks, e.g. paralysis. The user's manual must be reviewed for detailed disclosure.